And you will see that they advocate for 5 cycles, and we shouldn't take more than 2 minutes. Okay? What gets confusing is when they put up notes for you just to read as a review, be cognizant of the fact that it says we're trying to achieve approximately 100 compressions within 1 minute. Just 1 second, please, and they're gonna go over that. Okay, thank you. Hello?
Alright, this time, just when you're doing the same things I just told you, when you're in front of this mannequin, you're gonna put your hand right under his jaw. So you could push up, but it has to be right under the jaw, so you don't push down on the trachea, so you could get the breaths into the lung. So you could actually do your compressions correctly.
So you're just gonna perform like 1 cycle, right?
You should not perform only 1 cycle. You gotta go for 5. At least till the rescue comes, unless you have a defibrillator around. Then you can bring the defibrillator, which the first thing to do is, and this is a test question, as always, turn it on first. But that's later on. Let's learn right now. But you're still confused. What do you need help with?
Yeah, look, I know that they say 5 cycles. I don't know, for example, she's going like doing the 30.
Yeah, 30 and 2 breaths, that's 1 cycle.
And 2 breath, okay, yeah.
And then you keep going right back to your 30 compressions, right back to it. Okay, so you're gonna do the 30 compressions, you're gonna give it 2 breaths, you're gonna go back to the 30 compressions, and then give it 2 breaths again, then go back to your 30 compressions 5 times, basically. So those are the 5 cycles.
Because she's not giving the breaths right now.
Yes, that's the
You
issue.
start after, you start with that compression.
That's because, yeah, the glitch in this video, but we'll get on with it.
In a 2 rescuer scenario, you would use a bag mask for giving breaths. You will learn how to use the bag mask in a moment. During this course, for any 1 rescuer activity, you will be using a pocket mask. When practicing 2 rescuer scenarios, you will always use a bag mask. Finishing her compressions,
Pocket mask.
Kate quickly places the mask with one-way valve on the victim's face. She delivers 2 breaths and returns to giving compressions in less than 10 seconds.
1, 2, 3, 4.
Now let's watch as Kate demonstrates the proper technique for using a pocket mask. Place the mask on the victim's face, using the bridge of the nose as a guide for correct position. Seal the mask against the face by placing the index finger and the thumb of your hand closest to the top of the victim's head, along the edge of the mask. Place the thumb of your other hand along the lower edge of the mask. Place the fingers of that hand under the bony part of the lower jaw near the chin. Open the airway using a head tilt chin lift. Lift the jaw to bring the chin forward. This will lift the victim's tongue, relieving a possible airway obstruction.
Exactly.
Do not use your thumb to lift the chin. Also, do not press deeply into the soft tissue under the chin, because this might block the airway. Press the mask down and lift the jaw to hold the mask tightly against the face and give 2 breaths while watching for chest rise. Actually seeing the chest rise with each breath is the best way to ensure your breaths are effective. Each breath should be delivered over 1 second. Right now we're going to pause the video to allow you to get into position to practice with the mannequins and learn the skills of opening the airway and giving breaths.
We'll do that next door. You kind of get the gist of it, at least? You got the gist of it? Do you kind of understand it? The 5 cycles? Right now you kind of don't understand it too well, but when we go next door and go hands-on with the mannequin, she would actually explain to you better and how to do it, you know, in front of you, which is hands to hands, which is much better. But like she said, we'll keep on going with the video.
Okay, now that you're in position, let's begin. Follow along with the video footage as you practice, and switch students on the mannequins when the video instructs you to.
I wanted to say about this right now. When you are doing your compressions and your 2 breaths, if you kind of do get tired, this isn't a 2-person situation. This is if you are with another person that also knows how to do CPR. If you do get tired, you can tell your friend to come in. Like basically switch turns, you know?
5 sets of 2 breaths along with the video. Are you ready? Here we go. Give 2 breaths. Watch for chest rise. Give 2 breaths. Give 2 breaths. Give 2 breaths.
That's a glitch in there.
Give 2 breaths.
All right.
Now let's practice compressions and breaths together using a pocket mask with a one-way valve. Remember to push hard and fast, pressing down at least 2 inches or 5 centimeters at a rate of at least 100 per minute and allow complete chest recoil. You also want to give the 2 breaths and return to chest compressions in less than 10 seconds. You should already be in position, so practice along as we combine both steps into one sequence. We'll do 5 cycles of 30 compressions, combined with 2 breaths. Are you ready? Here we go.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.